Good morning. Good morning. Happy Wednesday. Happy Wellness Wednesday. I hope you are having a fabulous morning. If you are just stumbling on my page, my name is Donna. I am a mom, a nana, a wellness advocate. I am a grad school student studying for my Master of Science in Clinical Mental Health Counseling, an activewear fanatic, a fitness fanatic, and looking forward to an interesting overview on a topic today. So when I started Wellness Wednesday, I started it because I've been in a lifelong battle with depression and anxiety. And as I grew in my journey, I found that sharing tips with others about how I was getting through things and learning from others about how they were doing it was extremely helpful. It's similar in some ways to peer support. So when I started Wellness Wednesday, the whole purpose was to give tips and stories and experiences that I have had in hopes that you will share back with me and that our tips together can help others who are watching, whether they're watching live or chiming in later. So with that said, if you're here, let me know you're here. If I don't see your comments or questions while I'm live, I will answer them afterwards because Facebook doesn't always show me all of the things. And just know that I welcome positive statements, encouragement, tips that you may have for yourself. And I welcome that. And I also welcome you reaching out to me and letting me know if you have topics you'd like to see me cover because I love to learn. And I certainly am far from knowing everything, which is part of the journey. Again, we try to stay away from negativity and politics because those are rabbit holes that just probably aren't actually going to do anybody any good. But I welcome your input. I welcome your topic suggestions. Let's get started. So with that said, I hope you enjoyed my video on event fatigue last week, which was directly related to hurricane fatigue. And it kind of wrapped up what was an unofficial 3-part series about the emotional side of hurricane prep, recovery, and the aftermath effects. Because it's more than just physical or the damage that we see around us in our homes, and in the lives of others. So it was kind of an unofficial 3-part series. It just kind of morphed into that. But my feedback says that, it helped a lot of people and I'm super excited about that. So it seemed like this particular topic that's been on my mind for a while, and frankly, it's always on my mind because I won't say we all, but most of us do this in some form or fashion. It seemed like with all these strong emotions that come along with hurricane and event fatigue, that self-medication is kind of a natural progression past that point, considering its relationship to all those negative feelings. So I wanted to talk a little bit about that today, and there's a lot of deep dives we could do on this subject, and if you want a deeper dive on some of it, shoot me a message. But for the most part, this is going to be an overview today because 30-ish minutes just isn't enough time to really do that deep dive. So what is self-medication? Well, it depends on who you ask and it can be extremely subjective. So from the emotional and physical perspective, self-medication is using substances or screen time or food to numb yourself or distract yourself from emotional or physical pain, which in small amounts, depending on what you're doing, can be productive, but it can also be a very slippery slope. And I forgot to say, if you're here, let me know you're here, but I already mentioned that sometimes I don't see all the things. From the medical perspective, self-medication is using prescriptions off-label or not according to the doctor's direction, or using supplements to treat medical ailments. And again, this is very, very subjective because there is a whole new movement, which I personally love, toward using homeopathic things to treat certain things. But again, it can be a very slippery slope. So from the homeopathic perspective, self-medication is using natural alternatives to treat illness or emotional states without consulting a doctor. For example, I have lived most of my life with some form or level of anxiety and depression. And because at the time that this was actually diagnosed, the counselor that diagnosed me died shortly thereafter. I was very untrusting, and I didn't have insurance, and I wasn't aware of things like NAMI support groups and agencies that offered counseling services. Good morning, Miss Kayla, on a sliding scale according to your income. So I dealt with a lot of it myself, and I bottled a lot of it for myself, and then kind of accidentally stumbled on some things that helped, like a friend. And some of you have heard this story before. A friend who decided they wanted to train for a 5K. So they asked me to start running with them. And I didn't think I could run because of some knee issues I had when I was in school, but I had outgrown that. So I started running with them. And then they convinced me to train for a 5K, to train for the 5K. It got a little convoluted there for a while. And that's essentially where the running started. But as I started running, I started seeing some differences in the way I responded to things. I was calmer. I didn't have such extreme responses or reactions to negative things going on in my world. And then with that came cleaning up my diet to fuel the running, because I still really wasn't putting everything together. And then the more I cleaned up my diet and the more I ran, the more I improved, to the point where other people were giving feedback. And so that's kind of where it started for me. And that was years ago. That was like 2008, 2009. So exercise, certain supplements that I've been on since the late 1990s, and a few other things, diet, like I said, exercise, and some mindfulness techniques. Over time, this all kind of developed. And Kayla, you're so funny. There are ways to do it in tiny baby steps where you won't even notice. But we can talk about that. But that's the homeopathic perspective, where you're kind of treating with natural alternatives. But you also have, again, that can be a slippery slope if you don't proceed with caution. Good morning, Miss Stacy. So here's some examples of what self-medication looks like before I get too far down into that rabbit hole. Drinking for social interactions, kind of to relax yourself or to have better social interactions, can sometimes be self-medication if it's not controlled. Good morning, Miss Ann. Using substances to cope with emotional or physical pain, or to manage emotional or physical pain, is an extremely slippery slope. And I'll give an example from myself, which is that even though I've never been a super heavy drinker, I also recognize that I had what is not always recognized by science as an addictive personality. So things that I purposely did not do because I feared, because I had addictions, I feared that it would go too far, was if I was angry or upset, I never, ever, ever went near a drink, because it was something that I didn't want to associate alcohol with dealing with whatever pain, emotional, that I was having, because I didn't trust myself, basically, is what that boiled down to. And I didn't trust myself that wouldn't turn in. Listen, I can't even keep games like Song Pop on my phone, because the next thing I know, I'll be doing that instead of everything else I should be doing. So I know my limits, and I knew that was one of them. I did not want to become that person that reached for an alcoholic drink every time I was upset or angry or experiencing massive stress in my life. So using substances to numb the pain, I know a lot of people that are a lot more, listen, I'm a better bowler when I'm into beer number 2. But if you're consistently using those substances to manage stress or pain, that might be a flag. Another thing is recreational drugs or stimulants to manage anxiety, stress, depression, or pain, just as I spoke of with the drinking, as well as expired medications or antibiotics. For obvious reasons, antibiotics can be overused, misused. If they're used against label, they can cause a lot of problems, according to the medical industry. They can create what's the word I'm looking for? Resistance. They can create resistance, Let's try that again. They can create, if you're misusing antibiotics, it can create strains of viruses. Well, viruses aren't treated by antibiotics. Strains of bacterial infections that can become resistant. And that's part of the problem we're experiencing today in general, is strains of things that are resistant to antibiotic treatment. Expired medications can, and I've done it. I've been guilty. Not that long ago when I was sick, I took a course of steroids that had been prescribed to me a year before that I was scared of. And then because I didn't want what I had to turn into a full-blown sinus infection, I was like, okay, I have since taken steroids as prescribed in this situation. These are old, but I'm going to give it a try. Maybe not the best move. But I did a little bit of research, and determined that they were within a time frame where they were probably still effective, and I still followed the label directions, even though it wasn't a current prescription. But again, very slippery slope, because when we start using prescriptions that are expired, or we're using them outside of their recommended purpose, it can cause a lot of problems. Another example of self-medication is cold or anxiety medication used to improve sleep, if that's not what it's, and again, guilty. I'm having trouble sleeping. My sinuses are a little jacked up. So I pop a Benadryl to just help me get over that hump. Again, this is kind of not really what this is intended for, and it can cause a lot of problems. Some people who do not have ADHD diagnosed use ADHD meds. Not sure how they get their hands on them, but I know there's lots of ways to do that, to improve focus and concentration. Use of any of these things that I've already mentioned, up to and including food to improve mood, can start to look like self-medication if it's overdone, if it becomes problematic. I've never really been a stress eater. There are certain circumstances where I would find myself in front of, as a parent, and it seemed like only as a parent did I ever find myself in front of the pantry looking for something to eat when I was aggravated. Most of the time that's not been an issue for me, but it can be problematic in terms of self-medication. And then there's other things too, like gambling, working too much, shopping, video games, internet, media. Those, Kayla, I promise I'm not attacking you. And this is kind of a funny story about addiction, so to speak. Sega Monopoly. So video games can be overused. They can be a form of self-medication. And they can also be addictive. Back in the day when Sega was a big thing, I worked for a local movie rental store, and we, on the weekends, would sometimes rent Sega. I've never been a big video game person, but for whatever reason, the Sega Monopoly was especially intriguing to me because it came with several computer characters that you had to figure out. And if you could figure them out, you could get certain properties out of them all the time. Well, the logical side of my brain was like, oh, we got to figure this out. The detective in me just could not stay away from this game. And it actually became a problem because we would have it over the weekend and I would not move from that television. I would not move from that game for hours at a time. And then finally just had to stop. I had to stop renting the Sega. I had to stop renting the Monopoly game because I couldn't stay away with it. Hence the reason I can't keep games on my phone, because it's just problematic for me. But all these things can be used as distractions, as ways to procrastinate with unpleasant things. And they can become problematic if they're overused or used on a regular basis. So what are the risks of, and I kind of touched on these already, the risks of self-medication? Well, especially with prescriptions and with herbal remedies, incorrect dosing can be problematic. Obviously, you can run the risk of overdose. There is a such thing as too much, even when it comes to herbal remedies. And as a fan of specific supplements myself, I can tell you that I am very, very cautious to make sure that I'm dosing the best that I can according to the knowledge that's out there. And I'm fortunate in that I am a grad school student, which means I have access to more scholarly articles and information on some of this stuff that helps me out. Adverse reactions. Adverse reactions can be an issue even with natural remedies. Again, expired medications, those can all cause problems, as can drug interactions. Whether it's a supplement you're taking or a drug, it's important to make sure that whatever you're using, especially if you're using it off label, which, the responsible side of me says don't do that. But there can be interactions with the other things you're taking, especially when it comes to natural herbal remedies. You can actually delay necessary treatment with this. If you have a serious medical condition that you're ignoring or you're treating with herbal remedies or natural remedies, and don't misunderstand me, this, again, slippery slope, I'm very much a fan, and I'm very much that person who goes and looks at natural alternatives for the most part first, unless there's something serious going on that I can't figure out and that I can't relate to something I've changed in the last few weeks. There are certain things that will raise flags that will send me to the doctor. But most of the time I do try to find natural solutions for whatever I have going on. But in the case of a serious illness or medical condition, you could be delaying necessary treatment. You could also be confusing symptoms. If you're having symptoms or reactions to something you're taking, it can confuse symptoms that present for diagnosis. So there are some issues there as well. Obviously, when it comes to food, Kayla, this is not specifically for you, just disclaimer. When it comes to food, there can be a series of eating disorders that come along with using food as self-medication. While I've never really been a stress eater, I was never diagnosed with anorexia, but as a teenager, as a young teenager, I probably was, or I was at least borderline. And I know that after much research, I do know that I had the mindset of an anorexic individual. And I was barely eating, and what I was drinking or eating, I was watering down or diluting or minimizing out of a fear of gaining weight, because when I looked in the mirror, I actually believed I looked completely differently than I did. And there are times I've seen pictures of myself where I was so thin that you could tell by looking at my hair and my skin and everything that something was wrong. I was not healthy. So unhealthy relationships with food can obviously lead to eating disorders. And there's a few of them that are talked about regularly. And there are others that are really not talked about as much that can be a serious issue. And then, of course, all of these things, the number one risk of all of this is addiction. Because, and I know nobody's going to like it when I say this, anything can become an addiction, whether it's healthy or not, if you become dependent on it. And that includes exercise. In days when anorexia was spoken of more and was discussed in more depth, a lot of times an exercise addiction, if you will, would come along with that, where people experiencing that would literally work out 2 or 3 times a day or for hours on end with nothing but the motivation to burn whatever calories they took in and then some. And that can become very dangerous. You can run the risk of injury. You can run the risk of all kinds of physical things that, like I said, if we dig deep into that, we could be here for another hour. So for that purpose, let's move on to what the signs of self-medication are. And I think you're going to be surprised at how much they mirror the signs of addiction. And this comes in the form of primarily personality changes, but not always. So signs of self-medication, and again, it's amazing how much they parallel signs of addiction, can look like decreased socialization or activities. They also mirror signs of depression and anxiety, and a lot of times all these things come hand in hand and they feed off of each other. So decreased socialization or activities. In other words, a change in the way you're doing things. A sudden change in hobbies or your circle of friends, or your negative reactions to things. If you are reacting more negatively to things that you normally are fine with, or if your reactions are kind of becoming extreme, that can be a sign. Secrecy or lying about how you're spending that time. Because obviously if you feel the need to hide it, there's a bigger problem going on. That means you're embarrassed by it, or you're ashamed of it, or you are afraid that somebody's going to call you to the carpet on the issue. Neglecting physical care, or obligations. So that means neglecting basic hygiene, like not showering, not taking care of yourself, not fulfilling obligations. Sometimes that can be work, commitments you've made to friends, family members, whatever. And we all know what that looks like in the case of a full-blown addiction. People don't show up when they're supposed to. They don't show up when they say. They become extremely unreliable. Sudden anger, and I kind of touched on this a minute ago, extreme reactions to things that that are out of character for you or for that person may be an indicator that there's a problem. New or unusual financial issues that come with spending money on forms of self-medication, that are above and beyond what you would normally spend. New difficulties in work, school, or other areas that kind of spins off that not fulfilling obligations. Showing up to work or school late, skipping classes, things like that. And then, of course, that final one being addiction, which are addiction signs, which are withdrawal symptoms, lack of control, or inability to stay away. And this is something that comes along kind of with binge use, and I want to touch on that just a little bit. Or needing increasingly more of something to achieve the same effect. So when you're using medications off-label to address certain issues, specifically to like manage pain, and this is how people that are addicted to pain pills kind of get started. Maybe they have a surgery and they're prescribed a certain pill, but then once they reach the end of that prescription using it as needed, they're still experiencing the pain, or the pain is worse. And instead of a follow-up appointment to try to find reasons for this, if something else has transpired, maybe they just find a way to get their hands on that medication and continue using it more often. Same thing with alcohol. Alcohol can be used in the same way. And then more and more is increasingly needed to achieve the same effect. So where does that look like addiction? Because a lot of people are of the opinion, well, I can go a week without taking that, or I can go a week without drinking that, or I can go a week without using that, and I don't have any problems, so I'm not an addict. However, there's another side of that, and it was found primarily in college students initially, who could go literally months without touching alcohol or touching prescription drugs, or recreational drugs. But the problem was that once they got started, they did not have an off switch. So if you can't use the alcohol or the recreational drugs or the prescription drugs and stop once you've started, if you use to the point where you're passed out, or you're having short-term memory issues, or you're waking up in places you don't remember how you got there, that's a sign of true addiction. Even if you can tell yourself that you can go days, hours, whatever it is without it, whatever it is. If you need increasingly more to achieve the same benefits, or if you are using like I said, where you don't have an off switch and you're using to the point where once you start, you can't stop until you're completely obliterated, that's still a sign of addiction. Daily use is not necessarily a sign of addiction. It can be, but it's not the only one. So keep that in mind. And again, this applies to a lot of things. This applies to binge eating. Some people can eat perfectly normally. They get stressed out. They hit the pantry, and they eat until they're bloated and miserable and in the bathroom purging because they weren't able to stop. There wasn't a stopping mechanism there to keep them from going overboard. Same idea. And it can apply to food. It can apply to Sega Monopoly. That's just my little funny anecdote. It can apply to alcohol, recreational drug use, all of it. Internet. There's a lot of things tied into the internet now that are actually mentioned. Internet usage, web usage is actually mentioned in the diagnostic manual for mental illness as an addiction issue. It's just still a very broad, not very specific, but that can range from video games to doomsday scrolling, to games on your phone, like I mentioned, a song pop. Again, and these are out of control circumstances where this is your go-to to deal with physical or emotional pain, to distract, to procrastinate, etc. So, again, very slippery slope. Every single one of these things are things we could do a deep dive on. And if you want me to, please feel free to reach out to me by messenger, drop a comment, say, listen, I'd really like to hear more about X, whether it's eating disorders or alcohol. I think I've touched on eating disorders a little bit in the past. But here's some important things to remember, so that I don't take too much of your time today. Again, a lot of times these are overviews because we could get on these topics for days. So these are designed, these Wellness Wednesdays are designed to give you an overview of information that'll kind of plant a seed, make you think, maybe spark a change, or raise a flag if that's what's necessary. So here's some things to remember about self-medication. Even though they're less often talked about, caffeine, nicotine use, even simple things like that can be considered self-medication. Now, sometimes people place different importance on different things like nicotine use versus alcohol use, things like that, because they feel there's more imminent danger from some of them than the others. Good morning, Patricia. I'm wrapping up, so I hope you'll go back to the beginning when I'm done and watch from the beginning. And that really can be very subjective because all of these things can have negative effects. But 4 caffeinated beverages or more a day could be a sign that you are extremely dependent on caffeine and that there may be an underlying issue resulting in why you need that caffeine and that's kind of the idea behind self-medication is there's an underlying thing you're treating by your overuse of something. So 4 or more caffeine, nicotine use. And again, my second reminder, and I already said this once, is that anything can be addictive if it's overdone, overused, and produces negative effects. And those negative effects can look like, again, not eating enough, the effects of anorexia on your body. But more of the negative effects are on the people around you. If it's changing your personality in a negative way and you are isolating and you are lashing out at the people around you, then that's probably means that you're having a problem. I exercise a lot. I do. I exercise five to 6 days a week. But the most I exercise for at one time is 2 hours if I go do a jazzercise double. Maybe 2.5 if I add the stretch class on to the end of it. But if I was looking at my boyfriend 3 hours later and going, I need to work out, that probably means there's an issue there. And that might be a little bit of a red flag that there's a problem. So while I do depend on exercise to help regulate my depression and anxiety, I'm not overdoing it. I'm not exercising most of the day, and I'm making sure I feed my body appropriately to support what I am doing. So like I said, anything can be negative if it's overdone or if it produces negative effects. And that includes healthy alternatives. It's still kind of an everything in moderation type idea. Chances are if you go out to a mixer or you go out with friends, 1 or 2 drinks isn't going to do any harm. But if you can't stop there, if you're drinking to the point where they have to carry you out or they don't know where you're at because you disappeared, because you blacked out in a corner or whatever, that's a sign that there's too much happening there. So it can be a very fine line between social, normal use, 2 cups of coffee versus 6. When I was a teenager, I abused coffee because I felt like it was helping me lose weight. So I was going into the janitor's office at the school all day long, drinking their coffee. And that's a whole story for another day. But again, it can be a very slippery slope, even with natural alternatives, because even natural alternatives have limits. They have safe limits, they have side effects, and they have interactions with other medications you're taking or with other supplements that you're taking. And again, I have some supplements I've been on since 1990-ish. Well, since before 2000. And I believe in them, but every time usually once a year, I research those supplements, see if any new information has come up. If I decide I want to add something new, which isn't very often anymore, I research how it's going to interact with what I'm already taking. Also, at this point in my life, if I'm going to add something, I'm going to look and see if I can replace something else I'm taking with it. If it's Because if two supplements I'm taking are kind of going to do the same thing, then I really only need one, right? So there are some cautions there. As much as I'm in favor of natural remedies, I cannot emphasize enough the importance of arming yourself with knowledge, being aware, paying attention to your body, and adding supplements to your life in the right way so that you know if they're causing a problem. But again, that could be a topic for a whole other day. And again, not using daily doesn't mean you don't have an issue, because binge drinking, binge eating, binge usage is a real thing. It happens all the time, and a lot of people don't recognize that as a problem. Healthier options. There are healthier options. Mindfulness, relaxation techniques. I've talked about these many times before. Physical activity in moderation. Journaling, talking with someone that you love or trust that's close to you, or seeking help. I mean, if you feel like you've crossed that line from a little bit of self-medication or a little bit of coping to addiction, we have, NAMI has superior groups. NAMI is nationwide. They have a lot of affiliates. You can go to NAMI.org. You can type in your zip code into the affiliate search and find an affiliate that's near you that offers support groups. Most NAMIs offer the same support groups because those are nationwide programs. And then some of them offer additional ones. So, for example, NAMI Citrus is the local affiliate to where I live. There's a connections group and a family support group. These are more specific to mental health conditions, but they don't require a diagnosis for you to attend. And they don't ask what your diagnosis is. And there's here on a local level, there's 12-step programs and related type programs available through Club Recovery. And I can drop that link, a link to Club Recovery information in the comments. So if you do feel like you've reached a point where you need a 12-step program, those are available on the local level. And if you're not local here in Citrus County, then you can search 12-step programs or peer support groups near me. 12-step also operates heavily on the peer support concept. And start seeking help or seek help from your primary care physician. Make sure that if there's something you don't agree with on the part of the primary care physician, and I'm not saying you should question your doctor, but you are your own best advocate, and there's something you don't agree with. I just heard a story about someone who went to their primary care physician for serious depression, and was given a pill. There was no follow-up. There was no recommendation for counseling. There was nothing like that. It was just, here's a pill. And as much as I believe there are options out there for treatment, even though I'm not a big fan of medication, I also know that those medications were designed to be used in conjunction with other therapies like counseling. So if you're in a situation where you're being fed a medication and no other solutions, those were designed to be temporary in most cases, so that you could work on other therapies to work on the underlying issue. So, again, there are healthier options, and even some of those healthier options require some moderation. So in any case, that's about as much as I can say on this without, like I said, doing a deep dive where we're here for days. There are certain types of self-medication. And again, when I read you the definition, I told you it's subjective. I will remind you that food, a healthier diet is always a good form of self-medication as long as you're not overdoing it. And that is a thing. If you eat too many carrots, you could turn orange. So if you're eating a giant bag of carrots every day, that could be a little questionable. But a quote that is attributed to Hippocrates is let medicine be thy food, or let food be thy medicine, and let medicine be thy food. And there is some truth to that. So in no way, shape, or form is this intended to discourage you against homeopathic remedies, but just remember everything in moderation. And also sometimes look behind the motivation for which you're doing something. Because that's a lot of times what leads to the addictive practices that become problematic, is if your motivation, for the example I used, if I was going to the refrigerator and grabbing a drink every time I was angry, my motivation there is a little questionable, and that's a sure sign that that could lead to something more if I wasn't careful. So I hope you found this helpful. I hope you found some kernel of information in here that's helpful. If you do want to see a deeper dive on one of these pieces of today's topic, let me know. Shoot me a message, drop a comment, and I'll look into it for a future topic. But again, I hope you found this helpful. And if you do think it's helpful, please share. Maybe it'll help someone else too. In the meantime, I hope you're having a fabulous week. We are on the hump of the week, and I will see you next Wednesday. And in the meantime, be well. Bye.